Okay, so I think this tool is quite useful in being able to show prospective patients what one may want to do with surgery. For example, if somebody comes and sees me about their eyes and they want to talk about the areas that are bothering them, you could probably sort of say, well, if we look at your eyes, you have a little of, bagginess under the eyes right here, and you could draw that and show this is, what we call fat pseudoherniation, and it's something that we can deal with an operation that's called lower blepharoplasty or lower eyelid lift. And there's two ways of doing that. The traditional way is by making what we call a subciliary incision, where you make a cut like that, lift the skin and the muscle, go to the fat, and then stretch things out. The other one would be done through a cut on the inside of the eyelid, and through there you could deal with the fat as well, without any cuts on the outside. So that's a good thing. Other things that you can do with this is, of course, showing patients where incisions are going to be. For example, if somebody has a tumor in their face, skin cancer, for example, that has to be taken out. Normally, there's different options that would have, and the most basic one is what we call a fusiform incision, where you would cut the tumor with the surrounding normal skin and make it into a line like that. And so that may be an option or may not be, depending on where it is. Other options, for example, when you have a tumor, is taking it out with what we call an appropriate margin, and then rotating skin around, right? And so you would sort of design a flap, and you could show that this is going to go in there, and you're going to close this and end up with a scar that would look sort of like that, and then you would have the scar here like this, and it's an appropriate line. When you're doing Botox injections, for example, you can show and illustrate or even document on your chart. You could say where you put here, 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 and then you can actually probably even right here, you put 5 units, 2.5 units, and you could do that, right? The nice thing, I'm sort of playing around with this, if by shading this a little bit lighter and trying to get something that is a little bit more like a skin color, a skin tone, or something like that, maybe we'll try that in a bigger size. You can probably sort of shade a little bit of skin and or actually add, in this case you would probably add a little bit of, with a color like that, you could add light to a part of the nose that you want, which is where the light hits, and then we could probably go back and try a different color, and then you would shade areas to try to show more or less what you could do with a nasal refinement, right? And that's how you do computer morphing. Kind of works that way in some degree, but that would give you some idea, benefit of doing something. And the ability to record this, I think, is very, very good, because it allows you to one, document something verbally and visually. It allows you to keep this file in a chart for further reference. It allows you to give a patient a copy of this so that they can have, for medical legal purposes, it would be fantastic in terms of a consent when you discuss complications and exactly what you're going to do with the patient, because it's all recorded. The patient is asking questions and recording their voice. So I think with a little bit more tweaking, it'd probably be a very good program. I think, and may need a few other things maybe added to it as time goes by to make it more functional for a medical practice or a surgical practice. But so far, I think it's very good for basic things like this, and for teaching purposes, it would work very well.
Is there anything you would suggest that could be added?
So I would suggest if you could do a bit of computer morphing with the photographs, that would be great. If you could do some morphing at the same time in order to document that, and you could have pre and post photos, and that'd be nice. I think the ability to take a picture and use that picture pretty much on the go is fantastic, and that is very good. But I think the morphing is probably the better thing. And the one thing, the stylus is very good, but obviously the one thing is you got to learn how to use it, and it takes a little bit of time to be able to get, fine enough. For example, I try to write a 2.5 there very quickly, and it looks like a scribble. But those are things that, it has more to do with the platform of the tablet than anything else. But those are things that would be good. Maybe the other option would be to add, you could add some text and, add, put text like
Put
numbers,
notes in.
like notes in there, or just put numbers, right, and in different areas, so you didn't have to necessarily write them.
Fair enough.
To make it a little bit more specific and more clear.
Thank you very much.
You're welcome.
Bye-bye.
Made with Doodlecast Pro.